Thank you so much for joining us on this episode of Family Matters. My name is Purity Museo, and at this time where the conversation about COVID-19 is ongoing globally, tonight we just want to have a look at how this pandemic has affected you psychologically and how we could really survive it, because it has quite a lot of the psychosocial impact affecting families, affecting children, the healthcare providers, and of course the government officials. And to help us drive that conversation, next to me is Naomi Anyango. Yes, Naomi Anyango, who is a clinical psychologist from the Ministry of Health. Thank you so much, Naomi, for coming. And then at the far end, the gentleman is Javan Olang. Javan Olang is a counseling psychologist. All right, so let me begin with you, Naomi, just generally when the coronavirus, because when it was first, of course, reported in China in December last year, to other nations, let's say African nations or other nations where the virus had not spread, they had not taken this really, they took this matter very lightly. Probably you can tell us what the people in China were going through, because everybody thought it was a Chinese virus, and we also saw nations go ahead and evacuate their residents from China, thinking that they are going to be safe. Probably we can talk about what the Chinese government was going through, because at some point even the president was saying that do not leave us alone. There was a time he was saying that don't leave us alone, and asking nations to stand with the Chinese government. Probably you can tell us when it began, what especially the city of Wuhan, what they were going through economically, psychologically with their families.
I think psychologically there must have been a lot of distress, because that was something that was infecting people at a fast rate, and as it is a virus, they say that viruses, we don't have cure for them, so how are we going to maintain so that these numbers don't grow? So in the midst of all that, the confusion and the chaos, I think that's why even the president must have said that do not leave us alone. There must have been a lot of anxiety, a lot of panic, yeah, and as a result, it must have fallen back even to the citizens, because they're also worried, what is this, what is happening, and how are we going to protect ourselves? Yeah, so there must have been a lot of anxiety and a lot of panic, and I think also that's what we're seeing back home. But the message is, if we try and follow what we're being told by the government, that we keep our social distance, we maintain hygiene, I think we can manage. In fact, we will manage, but we just need to heed to this call.
Yeah.
Yeah.
And Javan, there were some utterances like this is a Chinese virus, you know, it cannot affect the blacks. Some of the impact, because at some point there was ethnicity being put into this virus. Probably how these people were affected, because even when they were trying to move to other nations, the Chinese nationals, they at some point faced lots of discrimination.
Yeah, actually that was a misguided statement.
Yeah,
from Africa. And actually, if you check, you see, this is started from China, so we believe that it's a Chinese disease. And actually, in Africa, it took some time before it came, and finally it arrived. So that perception, it went with it. And another thing, when you check coronavirus, though it's manifesting each and every day, it means that it's a virus for everybody, any human being. Yeah.
And Javan, let me stay with you. Let's talk about globally what especially governments are going through. You know, they are trying, and as even our government was saying, you cannot travel abroad to be treated for this. Every government is struggling. There's no country that has gotten any breakthrough as far as treatment or vaccine for this virus is concerned. Let's talk about what they are going through to just ensure that they safeguard their residents and citizens. Yeah.
Actually, the COVID-19, if we check how it's happening globally and how it's affecting our country, that is Kenya here, that one should tell you, you should have some mind that this thing is for all country, and this thing is countrywide, is for everybody, any country. So the only thing you need to do is to take care and follow the MH guideline regulations so that we will stay safe.
Yeah. Okay, I think, Naomi, you're in a better position to tell us what governments are going through, because you are from the Ministry of Health, and of course it's the one that is leading the national emergency response team.
Yeah.
You know, you're working day and night, and of course at the same time, people or citizens think you're not doing much to protect or to prevent further spread of the virus. Tell us, what are some of the extra duties that you are doing and research to just ensure as we hope that there will be breakthrough as far as stopping the spread of virus is concerned?
Okay, the government is working together with other organizations, for example, the Kenya Red Cross Society, and there's a toll number, there's the 719, then there's 1199 that people can call so that they can be listened to. Maybe they have anxiety or they are experiencing some sort of panic, someone on the other end will listen to them. And for the 719 specifically, it's for people who are exhibiting signs and symptoms of this illness, but it doesn't mean that it just ends there. Now, behind the scenes, what people may not be seeing, I know we are focused, we've been seeing the CS giving us updates on the way things are happening, but behind the scenes, as I've mentioned earlier, that we are working with other organizations. We have come up with standard operating procedures to offer psychosocial support. And this psychosocial support is for the patients who are affected, for their families, for the frontline staff, and for every other Kenyan that is experiencing this anxiety that comes with the knowledge of this disease. So what I'd like to tell people is the government is working behind the scenes tirelessly, effortlessly, to make sure that at least we work together in the fight against this pandemic, this virus.
And Javan, help us now put into categories the kind of people that are affected. I know every person is affected, but we have the elderly, we have children, we have healthcare providers. Probably we could begin with the people who are at the forefront as far as the COVID-19 response is concerned, and these include governments, of course, the healthcare providers, the doctors. Let's talk about some of the issues that they might be struggling with right now, apart from the ones that we know that, you know, you're putting your life at risk.
Generally, if you check the structure that the government has put in place to fight the coronavirus, and the guys who are at high risk of getting coronavirus, especially our health workers, we have our guys who are working at airport, and we have larger population, you included, myself included. Yeah. So just as she said that government has come up with good guidelines, and also we have other organizations that have come up to help us, and again we have some other CBOs that are also coming up also to guide us and help us to fight this coronavirus. Yeah.
And Naomi, psychologically, mentally speaking, or mental health speaking, let's talk about the impact of now the healthcare providers, their day-to-day interaction with the people who are affected or even suspected cases, maybe some of them mental health issues that could arise from this.
You know, mental health care workers are human as any other person, and they also have emotions, they have feelings. And they're in the front line, so they're seeing what is happening. They're seeing a patient come in with anxiety. That anxiety can rub off on them. And they have to remain strong because there's this job that they have to do. So, of course, yes, they'll have, mentally they can be affected, but that's why we have, through the Ministry of Health, we've come up with a team of counselors and psychologists who are going to be on standby to assist them, such that if a healthcare finds themselves on the spot, like mentally they feel they're not doing so well, then they'll be able to call a certain number and talk to the person, and they'll be able to be given what we call psychological first aid so that they can continue with their work. Because the reality remains that we need them. We need them, and we need them to be psychologically fit, psychologically strong, because if they are not, then we won't be able to do so much. So government has seen that and has done something, has set a team of psychologists and counselors, and we are still calling for more people to come on board to help assist, because what I know is in Nairobi County, people have been trained. I think in Wajir County, they will be trained. And other counties, they're training people who are going to offer this psychosocial support to the healthcare workers. And aside from that, we also have psychiatrists on call, and they are there for the patients and also for the frontline healthcare workers.
And in particular, let's talk about, because you are one of the clinical psychologists offering this kind of help, probably you can just tell us some of the issues that you've seen these healthcare providers struggle with, especially how this pandemic is affecting them directly, because they're trying to help with no known cure and just trying to treat these symptomatic illnesses that are coming with the coronavirus, but somehow they seem helpless, the fact that they cannot completely treat this virus or this infection.
I think for the moment we are doing well. Maybe it's attributed to the number of cases that we have. We haven't gone, we don't have, I think we have 42 cases confirmed. So far, they are managing, but we expect that things are going to start happening in the coming days, and we are preparing them. So how are we preparing them? Just telling them psychologically, they know what they will experience. They're healthcare workers. They've been doing this for many years for patients with different conditions. So they already have a feel, but it's just that this is a pandemic whose global outcome is stressing people out there. So like I said, they're human, and they also feel these things. So they know that at the end of the other line, there's someone that they can talk to who is going to reassure them and who's going to help them be able to cope. Aside from that, it's not just for someone to be okay psychologically, then even at their place of work, you have to give them tools that they need to work with. So I know the government is trying its best to ensure that people have the things that they need to work with. And that can bring some sort of confidence that we can be able to do this work. So that also psychologically makes someone a bit stronger.
If they have especially what the protective gears that they are required at least to protect them from getting this assurance that they will not have this virus spread to them. All right, and Javan,
just to add on something on what you said, the issue of psychosocial, apart from dealing with a client who was actually being infected directly, we have those who are indirectly affected. That is family members, children. And if we check the issue of quarantine, imagine a quarantine and you have kids of below 5 years, what do you need to do?
Okay, and we'll get to that. Let's talk about the people who have already been confirmed. You know, it's being, because it's a virus, it's a new virus. So once a case is confirmed, it's announced nationally. A 27-year-old lady tested positive, and somehow, the world is aware that you are among the 42. Let's say in Kenya, you are among the 42. Let's talk about, how we are doing it as the world, because it's not only Kenya that is announcing this nationally, or what they are going through. If, for example, you've been tested positive and you've watched what other people are going through, once you tested positive, you've taken days, somehow there is a sense of hopelessness.
Absolutely. Yeah, actually, the trauma and the trauma psychologically, you get disturbed. You get, that stigma is there, fear. Are you getting that? So the moment you tested and you turn to be positive and confirm that you're positive, what you need to do is a support. That's the social part of it, support. And how do you need to support you? Because if you check, we have a social distance, 1 meter, and what is support? So in this case, what you said, we have come up with there's an intervention that we've put across, whereby we'll be using phones to call these people who are confirmed. We give them hope, we counsel them, and again, we put them close to their family. Yeah, because that's the most important thing is family.
How are you doing that? Because once one is confirmed, the government says you cannot meet your
Absolutely,
family.
but we have phones. We have phones. Calls, we cannot transmit that virus through phone. So we can call them. And remember, these patients, they're walking, they're talking. If you go to Bangadi, they're talking, they're storying. They're just normal human beings like us. It's only that now they're being isolated. They're being isolated to that place because of the virus they've acquired. Yeah. So what we do as the organization, what we do is we bring more people on board, counselors, psychiatrists, psychologists on board, so that we see how we can help these clients. Yeah.
And you can tell us more what these people that have been confirmed positive for coronavirus, what kind of support, psychosocial support that you're offering to them, because apart from the fact that they are getting treated, somehow there's a lot of tension, there is no cure for this, there's no vaccine for this, they can only be treated for the symptoms that I'm exhibiting. You know, do you have any special program for them?
I had mentioned earlier that the government has come up with standard operating procedures that are going to be used by the counselors or the psychologists. And right now there are guidelines that are being developed, and I think very soon we should be having them out that are going to guide how this process is going to be moved along. And for the patients that are affected, this is mental. Yeah. So we deal with the issue just like you deal with any anxiety case. Yeah, the signs and symptoms of anxiety border around the same. So we encourage them. First of all, we know that statistics is telling us that there are people who are recovering and they're actually leaving hospital, and we have one of our own who has recovered and who will be released to go home. So even if you relay this information to the people who are there at Mbagathi or at the hospital, it's a sign of hope for them. So already that raises their the feeling that we can beat this. And the government just keeps reassuring them by even having the medics online working to help them. And the improvements that they make on a day-to-day basis is enough to show them that we can beat this, we can do this. But I know social media, there's lots of stories going on. I think there's something the CS mentioned about spreading fear amongst people. This is not going to help us. It will only heighten the anxiety. And you know, the thing with immunity is when you're too anxious, then goes down. Yeah. So what we are trying to do is to allay this anxiety, to allay this fear that people have, and just show them there's positivity around it. If yes, we know that there's people who have died, there are people who are still dying, but there is still hope. Yes.
All right, Javan, there's this case that Naomi is talking about, has undergone a test, they are negative, actually the patient is awaiting the last test before they could be released, and we are praying they are going to be negative.
Absolutely.
So once they come to the society, let's prepare the family, because again there is the fear and anxiety and paranoia that we are not very sure that this person is completely negative. Probably you can talk to people who will be interacting with this person, and also the person himself, because this person has been under quarantine for weeks.
Absolutely. Yeah. When that happens, actually, when a client turn positive and return home, we expect fear in the community, discrimination, and even stigma among ourselves and the family members, because they still have that belief that this person could have still be having such kind of viruses, stresses in the body system. This is why we come up as a psychologist to sensitize the community about this. And also we believe that though our government will also start doing that, producing the IEC materials to sensitize the community and tell them much more about the clients who have recovered. And again, for the recovered patients, they still need our support, care, and a lot of psychological counseling to make them go through their life system because of that fear and the trauma they had.
All right, hope you will be doing that as well.
Yeah, we are definitely doing that.
All right, let's now talk about the people, the contacts. Actually, we have the highest number of contacts as compared to the people who've been confirmed positive. And if what the CS today said is anything to go by, we have over 1,000 and around 40 contacts. These are the contacts of the people who've been confirmed positive, and many more. So once you are a contact, there is a process. You are taken under, put under mandatory quarantine. At this time, of course, you are awaiting tests to be done.
Yeah.
You don't know whether you're positive, you don't know whether you're going to turn out negative, because from these groups, there are people going home after they test negative. So some of the issues these people are going through, kind of what support do they need, because you are all alone in the room, honestly.
Okay. Let me go back and say that even for the people who've come back into the country, those who are already in quarantine sites, there are already some mental health, rather psychologists or counselors who've already been sent on site, and we will still send some more. So that basically means that even these contacts that are going to be picked and put in quarantine will also receive this psychological support, because of course there's that anxiety that comes with, I've been tested, what is the result going to say? And you know, as you wait, there's all these thoughts that are going to run through your mind, because you're trying to imagine what is it going to be. So at that particular point, there will be people who are going to help them calm down. And for the ones that are going to come out positive, they're also going to be assisted further, because now you've tested positive, and maybe you've still interacted with people out there, you're worried about them. It could be your wife, it could be your young child, it could be an older person, and so on and so forth. So still there's going to be that worry. So even them at that particular point, they're still going to be offered that psychological support to help them realize that it is not bad that you have been confirmed to be having this disease, but psychologically, this is the help that we are going to offer you, so that you can be able to run through the whole course of treatment. Yes.
All right. So Jovan, let's now help us highlight some of these problems, the psychosocial problems that the world may be going through, because even Kenya, I could be sick, you could be sick, that's what the CS said, only because I'm not symptomatic. Let's first highlight some of the issues. For me, I could say I'm anxious, you know, there's panicking, you're stressed. Let's first highlight them, and then we have a look at now. She will help us know about the symptoms of someone who's really been psychologically affected. What are some of the behavioral change? Yeah.
When you check on that, first of all, we will check on our economy. We start from economy. Yeah. It starts from our pocket. Is it fine? What is happening? Is it right? And we have a lot of effects that are taking place here and there, especially what you've said: fear, anxiety, panic, discrimination, stigma, all those. What I will urge and what I will say that maybe our governments can do at the moment is to ensure that everybody follows strictly the guideline that they've produced by the MOH. We follow the guideline and we do what is required. I think that if you do that, even that's the stigma, the fear will go away. As you can check right now, even if you sit in a matatu next to somebody, that fear is still with you. If you're walking, that still lives with you. The family, maybe you're a young family, that fear is still with you. The anxiety, what next if I'm caught up with this disease, with this virus, what next? So we'll only urge the government to continue sensitizing much about COVID-19. Yeah.
Okay, so if we follow, for example, what
the guideline,
the guidelines provided 1 meter, keeping 1 meter distance, thoroughly washing your hands with soap and water, you know, we will be fine from that. But still, there are people who may be asking, how sure are you that when I strictly adhere to this, because there are also talks about the virus mutating, could be airborne, there is still the paranoia among people. The reassurance.
That is very true. Yeah. But what I would like to urge the viewers and Kenyans at large is this: stop watching or following too much news about this, because this is what is making you get anxious and panic. You might find that you get a sore throat. Maybe you've passed through somewhere that was dusty and now you're afraid, do I have corona? Or you start coughing and you're thinking, oh my goodness, I have this thing. But it's because of this, there's so much going on social media, and there's a lot of misinformation. Personally, what I do is I check the WHO website in the morning and in the evening. Then the time in between, I don't bother to check again, apart from now what the information that we get from the CS, which now particularly pertains to the situation in Kenya. Why I say this is, again, watching too much of this is going to heighten the anxiety levels, and it will make people, and I think that's why even at the onset, you'd see a Chinese person and people are already branding them here in Kenya. Or I think it was at the coast, someone was beaten because they thought that they had this virus. So people, let's try and do what we call self-care. Take care of yourself. Apart from washing your hands and keeping the social distance, do new things that you've never done before. For example, you have a radio in your house. The people who have smartphones, you can listen to music over them. Dance. Let the steam go away. Let the stress ebb off. If you have children in the house, create new routines with them. And the case with children is they thrive well on routine. So don't keep changing things every now and then. You're going to cause a lot of commotion and a lot of confusion with them. So like what I saw with the family that you were interviewing, they were singing together. These are things that you can do, and it will make you realize that you just need to lower your anxiety by not thinking too much about this virus. The government is there and it knows, it gets information, it coordinates with the World Health Organization, and it coordinates with what is happening on the ground. And at the end of the day, we are able to get information, and we are told, today we have 42 Kenyans and one has been treated. Okay, so let's just limit what we consume from the social media as regards this virus. Otherwise, anxiety levels are going to go up.
Right.
There's going to be lots of headaches, lots of stomach aches, and lots of people who are sweaty and, you know, clammy hands and all that. But it's just the anxiety.
Yeah, and like you said, anxiety will lower your immunity.
Yes.
And you become
and we don't want that.
You become vulnerable.
Yeah.
But there is the issue of social distance, Javan. So when you go, for example, you are still working because we are under curfew. So let's say you're working from 7 in the morning, evening you're going home to your family.
Yeah.
There is the issue of social distance. How do you behave with your children? Because you also do not want to pass it to your children just in case you have been infected.
Yeah, actually, that's what I said earlier on, that the fear that we have, that fear, our sense is in fear. And social distancing, it simply means that actually you've drawn 1 meter apart, okay? And yeah, you've come from a job, you're working with people around, getting in contact. The best thing to do, the first reach in the house is hygiene, personal hygiene. You can get in the house, bathe, remove your clothes, do new clothes.
All right. So we've talked about this, the mental aspect of it, but there is an effect on the economy, you know. So many businesses are not open anymore. People are not, you know, we have so many casual workers in the country. And so that itself, maybe we can talk about the economic impact as far as coronavirus is concerned, and how do we cope up with that, even as we stay at home with our families?
Like currently we have a curfew that is running from 7 p.m. to 5 a.m. And remember, we have some business that are also running at night. Like we have bar clubs, we have some hospitals running, or those hospitals are open. So many people are doing business out there at night because Nairobi is a 24-hour economy county.
But only not, it's been affected because one, as far as the restaurants are working, it's only under the takeaway basis.
Absolutely.
So you're not having people come and enjoy themselves there. And so at the end of the day, there is a loss.
Absolutely. That is very true. I was coming to that. So if you check out the economy with the curfew and the corona thing, people are closing their business. Their businesses are generally closed during the day and at night. Because we suspect that those are the areas whereby corona is can be highly gotten from those areas. Like if you check at the hotels, at the beaches, our airport was closed down the other day.
Even businesses in town.
Absolutely, that is true. So generally when you talk of economy, actually the corona thing has actually affected the economy. And if you check at the countries that are giving us money, like US, if you consider the deaths that are happening there, the statistics, the number of cases confirmed, the deaths that are happening, it's so worrying. And that means that general economy will be at a mess. And
so how do we help us Kenyans being affected by this economically, because there's someone who cannot completely operate. You know, there are people who, let's say, work at night, their businesses work at night, or even during the day. Most of them have chosen to close their businesses because they do not want to take chances, you know, as far as this virus is concerned. Not because there is a lockdown, but you just want to take care. There are also no customers coming because everybody is at home. Yeah.
I'll start by saying that necessity is the mother of invention. So it is necessary we stay indoors. And out of this, some people have been able to come up with new ideas with how they can do their businesses, for example. I've seen people who are not doing business online before, right now they're doing it. And of course, after a while, they'll be able to gauge and see how well it has worked for them. This is a pandemic that obviously is not just affecting Kenya alone, it's global. So businesses globally are suffering, but that's unfortunate for everyone. I mean, even as our movements have been restricted or limited because of this, so each and every person has to suffer something so that we get to the common good. So if social distance or quarantine or lockdown means that we are going to arrest the spread of this virus and ensure that we are able to thrive later, then so be it. There's nothing that we can do beyond, or unless we all have a death, which I don't think is the case. Yeah. So I think this is something that all of us are going to have to suffer. And we just have to wait out and see how it pans out eventually.
All right.
Yeah.
And let me break it more down, Javan. Remember, at the end of the day, actually the CS was telling employers to just release the employees on time so that they get home before 7. But there is also the issue of people want to be out there, work, because you have responsibilities. Like, for example, you do not know whether your landlord will say, don't pay rent at the end of the month, for example. Even for your business, you do not, because let's say it's you're paying either your landlord or the county government. You do not really know, because there's no directive that people should not pay rent or for the areas where they're operating. So there's that dilemma by business people. As far as the government is telling them, hey, release people early and on time, there is also someone who owns that premises who has not spoken yet whether, and it's actually the end of the month. So they don't know whether come April 1st they will be required to pay their rent, and also the employer will be paid in full. That's the dilemma for most people. Probably, do you think the government should come out clean on that, or how should that be addressed?
Yes, Spirit, first of all, you need to know that it is the government that actually locked things down. Yeah. Not people locking the business down. You understand that? Yeah, so what I will urge government to continue doing, as much as they've done the curfew from 7 to 5 a.m., for some business, I believe if they can extend time, as opinions are said there, up to around 9 to 5 a.m., it will be better for some business, especially in transport sectors. Check what is happening in Nairobi currently. The transport is double, especially in the evening. People are grumbling. Take a matatu. Why? Yeah, because we were afraid of the curfew. And you know what happens with the curfew. You have our brothers in uniform, what they do at the end of the day. Yeah, so government can extend, or however, if that's not happening, let government get out the school buses to help people, ferrying people from their job places to home. Yeah, I think that will be better. It will be better. Yeah.
Naomi, what do you think about that? I know we have different businesses that we are doing, jobs that we are doing. Probably you can just give us a few tips, apart from there are businesses that can work well online, but there are others that you just have to go, for example, mjengo. Some people, construction work has stopped. So there's that person who really relied on this job, mjengo, to put food in the table of their families. So probably how do we balance that? Because we've seen other nations like Nigeria, they have some response, food emergency response for their people. Have we gotten there as a nation, or do we need to keep struggling and moving?
I think the government is listening to the people and hearing their cry, and they are working on how to respond to this. And I'd also like to urge employers, let's have a human face, yeah? Like what we saw the other day at the coast wasn't a very good sight, but let's have a human face. We are in this together, all of us. Yeah, so it's not a time to think about how we are going to drive our profits up, but it's a time to think you could drive your profits up, but then you will not have someone to work for you tomorrow. So what is going to happen? And because we are suffering in this, all of us, we're in this together, then we need to think, how am I going to be my brother's keeper? And I think employers are being urged to release their employees early enough so that they can be able to beat the traffic and so on. And just overall, I know that the government is working towards helping people out when it comes to that.
All right, let's talk about the curfew, Javan.
Yeah.
Cases of domestic violence on the rise now. You are a psychologist. I'm very sure you've received several cases. Why is this so?
I think people are not just used to one another. I can say that in the house. Especially in a case whereby a father, you go to job in the morning, you come in the evening, you meet your wife, you talk. But here comes a case whereby you people are together in the house as early as 7 p.m. I think that. So for the cases that we've received for gender-based violence, it's whatever the people are not used to one another, and in the kind of marriage setup in the house, whereby you get we have a wife working somewhere, a husband works somewhere, at the end of the day they meet in the house, then they start quarreling from nowhere, actually, for a petty issue. Like just the other day we received a case of gender-based violence of a woman being beaten by the husband because of some simple reasons. Yeah, that can be dialogued and acted upon. But what we do, we have the channels of gender-based violence, how we go about it. We have the flow, it's there. If you receive a gender-based, what you need to do, you need to report to the police station. From there, we follow the channel, and that's how it comes back to us. And again, away from gender-based violence, in the family, whereby, how can I put it? You're like 5, 6 in a family, and you get maybe husband traveled somewhere, went to Uganda and came back, and you get that the wife actually will want this lady to, the wife will have this man to quarantine himself, but the man will actually refuse to do that. And that will bring a lot of problems, a lot of fights in the house, and it ends up to a lot of chaos.
All right. So how do we, because at this time we really need to coexist as far as this curfew is concerned.
Sure.
And Naomi, leave us with a few tips.
This is, I think I've heard people say that this disease came at the right time. The right time because people had grown apart as couples, but now it's time to find each other. Yeah, find out the hobbies or the things that you like to do together. And it's not just as a couple. People also need to bond with their children. I've seen in other forums people complain, oh, the kids are here, the teachers do so much. Yes, they do, but it's also time for you to be with your child. Know who your child is. What do they like? What don't they like? What new thing can you teach them? Play games with them in the house if you have a compound out there, and just enjoy that time to be as a family and bond. And as you do that, of course, you're keeping that safe distance. You're not going to the neighbors because you don't know. We were told that the person who could infect you is the person sitting right next to you. So as a family, bond, work together, spend time as couples, get to renew that fellowship that you had when you met before you had the children and so on, and just grow. Yeah, I think people will miss this period afterwards.
Really?
Yeah.
All right, Naomi Onyango, thank you so much for your time.
Thank you.
You needed to say something before you wind up because time is not on our
side.
Yeah,
actually, what you need to do, let's follow the government directions and directives. Let's be in the house at 7 p.m. We leave at 5 a.m. Let's wash our hands always. Let's do the necessary to ensure, because Corona is real. It's real. It's real.
All right. Javan, also thank you so much for this timely conversation. Of course, I hope we'll have it again and again, because we are hoping the pandemic really ends soon. But we
Yeah.
really need to keep on helping the families. And
Yeah.
thank you for
Absolutely.
watching at Oiweri. You're saying you're watching Family Matters tonight. Thank you so much, Bob Otieno, learning a lot from Family Matters KBC. Thank you so much for your feedback and for keeping us company tonight. I'm Purity Museo, and Lucy Mora has been our sign language interpreter. Good night. Stay safe.